From theory to bedside, we're decoding the art of clinical reasoning one student at a time. Good day, we are Group 3A from BSN 3C. We are here today to present our research study entitled Clinical Reasoning of Nursing Students by LOZADA, LUMAWAG, MAHAYAG, MALACAD, and MALACON. This study aimed to determine the clinical reasoning abilities of nursing students at a university in Bacolod City. It sought to examine differences in clinical reasoning when students were grouped according to sex, academic year level, and general weighted average. The research intended to assess whether these demographic and academic variables significantly influence the development of students' clinical reasoning skills. The study utilized a descriptive quantitative research design to assess the clinical reasoning abilities of nursing students. It employed a standardized clinical reasoning scale adapted from Huang et al. To collect data on students' reasoning proficiency. Data were gathered through surveys administered face-to-face and were analyzed using descriptive statistics, the Mann-Whitney U-test, and the Kruskal-Wallis test.
The sample. The participants of this study were 248 nursing students enrolled in the second, third, and fourth years at a university in Bacolod City during the academic year 2024 to 2025. They were selected using stratified random sampling to ensure equal representation across year levels. The sample included 94 second year, 60 third year, and 94 fourth year students. First year students were excluded due to their limited clinical exposure and focus on foundational nursing theories. Instruments. The instruments used in this study was a clinical reasoning scale for nursing students adapted from et al. It consisted of two sections, demographic information and a 16-item scale measuring four domains of clinical reasoning, awareness of clinical cues, confirmation of clinical problems, determination and implementation of actions, and evaluation and reflection. The instrument had a validity score of 4.76, interpreted as excellent, and demonstrated strong reliability with an overall Cronbach's alpha of 0.894 and domain-specific alphas ranging from 0.789 to 0.839. Each item was rated on a 5-point Likert scale to quantify participants' level of clinical reasoning.
Moving forward for our results and discussion, for the demographic profile of the participant, results indicate that in terms of sex, 75.8% are females, while 24.2% are males. Regarding academic year level, the distribution is relatively even, having 37.9% in second year, 37.5% are fourth year nursing students, while 24.6% were classified as third year nursing students. Lastly, in terms of academic performance based on general weighted average or GWA, 59.3% of nursing students fall under the very good category, followed by 30.2% in good category, 7.7% were classified as excellent, and 2.8% are classified as satisfactory.
Next, for the level of clinical reasoning among nursing students, data indicated that the mean score is 66.53 with a standard deviation of 7.697, indicating a moderate level of proficiency in clinical reasoning, showing an adequate level of competency but may have gaps in specific areas requiring improvement. And there is no significant difference in the level of clinical reasoning among nursing students in terms of sex, academic year level, and GWA. It implies that whether nursing students are male or female, in second, third, or fourth year, and having either satisfactory, good, very good, or excellent, they are all having a moderate level of proficiency in clinical reasoning.
And for our conclusion, the study concluded that nursing students across second, third, and fourth years demonstrated a moderate level of clinical reasoning proficiency. Statistical analysis showed no significant differences in clinical reasoning abilities based on sex, academic year level, or general weighted average. These findings suggest that demographic and academic variables do not strongly influence clinical reasoning development. The moderate level of proficiency can be attributed to the fact that each academic year exposes students to entirely new clinical environments, such as the delivery room in second year, psychiatric and operating room in third year, and intensive care unit in fourth year, causing them to revert to a novice level as they adjust to unfamiliar roles and settings.
It is recommended that administrators incorporate more simulation and case-based learning into curricula, for faculty to foster critical thinking using clinical reasoning maps and structured reflection, for students to engage in active reflection and seek feedback, for families to support emotional and academic development, and for future researchers to explore qualitative factors influencing clinical reasoning development. Attached to the poster is the QR code for our references. Thank you for listening. Have a good day.